Pop quiz number 101. A preemie Paris client 3 days postpartum is to be discharged on heparin therapy. After teaching her about possible adverse effects of heparin therapy, the nurse determines that the client needs further instructions when she states that the adverse effects include which of the following? 1. Epistaxis, 2. Bleeding gums, 3. Slow pulse, or 4. Petechiae. And guys, the correct answer is 3, slow pulse. So let me explain this to you. Whenever you guys get a test question about a medication and they're asking about the adverse effects and you have no clue. You have no clue what the adverse effects of that medication are. Here's the tip. Think about what that medication does and what can happen if it works a little bit too well. So we have a medication such as heparin that keeps the patient from clotting. But if it works a little too well, it can cause what? Bleeding. So yes, epistaxis, that's the nosebleed. Bleeding gums, petechiae, all of these are adverse effects. Just think of what happens when that medication works too well. But slow pulse? No. Think about it. If that patient's bleeding out, you'll see what? Increased pulse. You'll see tachycardia. Why? The heart's trying to compensate for that blood loss.